Good evening, everybody. My name is Kazala Yasmin, and I am a doctoral candidate at University of Maryland Global Campus. My talk for today is on risk and challenges of telemedicine implementation during pandemic. Telemedicine is an information technology system that supports medicines remotely for best patient care. COVID-19 has some crucial social, cultural, and economic impacts, and it is directly affecting the healthcare providers. During pandemic, telemedicine is a quickly evolving practice by healthcare professionals. IT services are challenged to fulfill healthcare staff and patient needs. Its demand is expected to increase in the coming years. And we also thought that this is the future of artificial intelligence also. Telehealth can be used for multiple modalities of care by the healthcare provider. A patient can talk to a healthcare provider or a doctor live, either on a phone or a video chat. There are multiple platforms in the technology available to serve this need for telehealth, and there are cloud-based services available for provider where they can communicate with patients through video calls during live calls, and patients can discuss their healthcare related needs through voice or video. This provide an increased collaboration between both the parties to satisfy their needs by seeing actual results that the provider is viewing with them in a real-time scenarios. People call this also telehealth, digital medicines, e-health, or m-health. It all covers telemedicine. The purpose of the current study is that there is a lot of studies, not now, but earlier, done in healthcare, which were only specific to organizational readiness for telemedicines. There are few which are discussing more of the challenges associated with telehealth. Some of them are talking about the importance of telemedicines. But this study will be unique to bringing all these together and see how effectively it can help to implement telemedicines in the real scenarios. So the purpose of this paper is to explore the importance of organizational readiness and staff training to implement telemedicines and overcome technological challenges after COVID-19. This paper also highlights the impact and risks and values telemedicines can bring to our lives. And it talked about the three main themes, as I said, the importance of telemedicine, technological challenges associated with telemedicine, and the organizational readiness to implement it. That's how this paper will fill in the gap to bring all these themes together for effective implementation of telemedicine. As we know that we are going to in a new normal, and healthcare system is the front line. There are a lot of challenges that we are facing, which are some of them in the current scenario of COVID-19, and some of them are the strict healthcare laws and regulations. As we know that the technology brings a lot of changes to every business, and if some of the healthcare organizations they are not taking the edge of the technology, it means they are lagging behind. Health Information Portability and Accountability Act, which is called HIPAA, rules and regulations prevent a lot of IT organizations from coming forward and implementing technological changes. The change in culture is to bring telemedicine and traditional ways of practicing medicine seems not an easy option for healthcare providers in COVID-19. And this change requires a lot of education, research, and the willingness to change. when when we talked about the HIPAA flexibility during the current situation of COVID-19, HIPAA has a very good news for the healthcare provider so that they can effectively use telemedicines or telehealth. So according to HIPAA, new flexibility in their law is that they provide telehealth services to patients using remote communication technologies. They allow that to the healthcare providers, and they can use commonly used apps, which are FaceTime, Facebook Messengers, Google Hangouts, Zoom, and Skype for telehealth. And on the same time, on the same note, they discourage to use the live platforms, which are Facebook Live, Twitch, or TikTok. Talking about the CDC's guidelines, which is to operate effectively during the COVID-19, the healthcare providers, they have to deliver the remote healthcare services to reduce in-person care, as the patient safety is the priority. They also recommend to follow the infection prevention and control recommendations if in-person visits are required, which means that the patients who need in-person visits to see a doctor, they are more vulnerable to COVID-19 and all the other viral infections around. It is highly recommended, therefore, that if in-person visits are required, then the healthcare providers, they have to follow the strict guidelines so that to avoid the infection or the disease transmissions. The healthcare providers also provide necessary in-person clinical services in the safest possible way, so to minimize disease transmission to the patients. Talking about the laws of HIPAA and the recommendations of a CDC, we cannot negate the importance of telemedicines during the pandemic, as it is all about the patient care and the safety to prevent the infections and more transmissions of infections. It also helps to improve the healthcare access during crisis or lockdown situations. It decreases the hospital admissions and it reduces the overall cost of a healthcare providers. By implementing the CDC's guidelines, which are mentioned earlier, more specifically of a social distancing, telehealth or telemedicines has a vital role to apply or to follow those guidelines. It also enhances the use of technology to monitor the chronic conditions. The new thing or the addition that I have for the importance of telemedicine in pandemic is introducing the video conferencing and over the phone scheduling, or bringing more of IT things into telemedicine, which is not a new in telemedicines or healthcare industry, but it is most widely used, whether the hospital want it, whether the physicians are in favor of it or not. This was the need of the current situation, that they were using the video conferencing and over the phone scheduling more than ever they were using it before. Before going into the implementation of a telemedicines, I use this picture for my viewers to better understand the process of implementation. This is just an example, and where it shows the nursing home that can be just a home, a nursing home, or any other location where the patient is actually contacting the hospital or the medical labs or the doctor's office. The main network, the main lead in this whole implementation is a secure network, whether it's a local or it's worldwide. That is connecting all of these together, working together, providing and meet the need of the patient. Talking about all that and implementation, organizational readiness is very important. We have to search for whether that particular organization or hospital is willing, their leadership is willing and have a commitment to effectively implement telemedicines. We have to search or look into the details whether that organization have already equipped with the technology and their staff is trained, meaning they are already having or using telemedicines in one way or other, or this is a whole new scenario for them. Depending on the needs of any organization or a hospital, we have to also look into the clinician's readiness and buy-in. If anyone who is in my audience working with healthcare or her or himself is in a leadership role with the healthcare organizations, they know when I change the leadership willingness with the clinician's readiness and willingness. In a hospital scenario, there are leaderships who are doing some part of which are related to the sometimes with the clinicians. They are the doctors and they are in the leadership role. They are therapists in the leadership role, but this is not always the scenario. Program staffing and resources for implementation that we have to look into, that they have the resources available to implement telemedicines. As I said, some of the hospitals, they are already using it in one way or other, and there are some who have not at all used, so they don't have resources available. It's all about the process change within the hospital or a clinic, and that's why to meet those workflow needs, the staff need a particular training also. By taking care of all these, it will lead us towards creating a sustainable program. Patient education is another thing which is associated with organizational readiness, and it is recommended by a lot of federal agencies to the healthcare providers to educate the patients so that they know if there is something new coming up that can meet their care needs. Talking about all that, there are some technological challenges. So after checking the organizational readiness, we have to look into if they implement telehealth, then what are the technical challenges that the organization can go through? Well, the top priority or the top most challenging associated with IT anywhere other than healthcare is cybersecurity. Healthcare provider or the healthcare industry is more vulnerable because it has to meet all the HIPAA rules and the federal laws for the patient record safety. So cybersecurity is the biggest challenge. The consumer technology, which means that the patients here act as a consumer. What type of a technology they are using can also affect the technological challenges of the provider. Because if you're elderly, I'm just quoting an example, being in a hospital environment, we have patients who are above 90 or 80s and they don't use the smartphones, and we are encouraging them to use a video conferencing and to over the phone scheduling, so it will be a big challenge. There are also the limitation of a video conferencing depending on what type of a network the hospital is using. Not only that, but what type of a network the patient have at the home to use the video conferencing. The initial cost associated with the setup is also a challenge for those organizations or industries or the hospitals or clinic, which is completely taking it as a new scenario for telemedicines. Time management is an issue for the physicians, for the therapy, for the nursing, because they are using a multiple EMRs during the call. So there are different patients, there are so many tabs open at the same time. They're dealing with switching between the tabs, and that also taking us towards the accuracy and the quality of the services provided. And actually, that accuracy and quality is going to be an evolving issue of mixing up of the patient data at the hospital level. The last but not least, the technical challenge is the interfacing. As I said, that there are not a lot of smart devices, which are not only the smartphones, but watches and all the other apps which are on their computers, on their phones, and on their watch. The example is an Apple Watch also. The patient record their vitals and their data on their devices, and then hospital or the physicians, they cannot use it directly as is. They have to pass through a system to be in the records of that particular hospital or the clinic, and that is the interfacing. Talking about all these stresses, all these laws and issues and the challenges, I bring up that the theoretical framework where this can be fit in with all the pieces of the puzzle together. And I highly suggest to use the organizational learning theory. This organizational learning theory stresses the importance of developing a learning culture within an organization. And that learning theory has 5 essential components. That is the personal mastery, the mental model, the shared vision, team learning, and then it leads to the system thinking. This theory is better explained when all of its components will be understood and they are interpreted well. So learning in any organization starts with the individual. And the personal learning and mastery is the process in which changes in knowledge take place in the individual. So we can say that organizational culture is the set of beliefs that are shared by the individuals of the organization. So the learning process is directly linked with the production, which means that the individual who is learning will come up with some influence to bring the change. And that shared vision is essential to building a team because it promotes dialogues. And among the employees have the same mental model, it provides common cognitive foundation for productive discussions, which means the participants, they regard the information they share and the information which is unique for them. So in short, all 5 components of the learning organization theory are critical, but we can only achieve the goal and desired output when they work collectively. So in my paper, I use the learning organizational theory and I created a conceptual framework to implement the telemedicines in healthcare industry. So in this case, the personal learning is a seed to achieve the system thinking and organization's desired results. So the components of learning organization could be achieved in 3 phases. The cognitive, which is a change behavior, and output phase. In the healthcare provider scenario, the cognitive level is the individual learning. And that individual learning will lead into a healthcare team, which team is trained and equipped enough to meet the technological challenges. And in the last stage, which is the output or a third phase, the organization will be on a right track to implement telemedicine with the confidence. After going once we apply that, there are recommendations that the organization to effectively implement telemedicine, it is vital to assess the organization's readiness and willingness to adopt the change. So every healthcare provider will have a different and specific technological needs. The quality of the services and the staff. Well, staff's training is also related with organizational readiness. Once the leadership is willing and they have a commitment, they see all the organizational readiness components that we discussed earlier are together, then they have to train their staff accordingly to effectively implement it. The quality of the care, the telehealth for remote monitoring adds value to patient care for several chronic conditions, including communication and counseling. The quality is also discussed in the means of time savings and cost reductions for costly visit to emergency rooms and unnecessary hospitalizations. Telehealth also can provide increased healthcare utilization changes due to increased information that allow them to adjust their treatment plans and provide more personalized treatments for the patients. So remote monitoring can provide access to the information specific to the patient in a real time. And it is a cost saving to meet the future needs. In general, it's noticed that telehealth increases the cost of patient care and patient visit, equipment used for the hospital, and everything. But this is just a one-time cost which is used. And it will not be used as a patient will have their technologies available. But in the settings of our telemedicines, may be seen as an initial additional investment. But over time, this can save a lot of money. And in today's world of IT, where IT is serving as a service and outsourcing organizations, providing a lot of services, upfront investment for the hospital is very, very minimal. And at the end, I conclude that the pandemic taught us many lessons it also trained us in many ways. And for healthcare providers, for the healthcare industries, it's no give up. That's what the hats off to all the frontliners. So pandemic will be over, but telemedicine will stay. Thank you so much. If you have any questions, please.